For my inaugural hair blog, podcast, or whatever you like to call it, I'm going to talk about pi r squared. Before all of you freak out who are not math aficionados, don't worry. I am not a big fan of math myself. My wife, who is a physics and math major, is a genius at math and probably could tell you a lot more about pi r squared than I could. Now, why am I talking about this weird geometry? Well, I actually use this formula every day as I talk to my patients, and I'll explain to you why. So pi r squared is the geometric description of area for a circle. And in terms of a hair transplant, the reason it's important is several-fold. First is the caliber of a hair. So if you think about various factors that can lead to improved visual density from a transplant. A lot of people say, well, how many grafts do you use? Do you use 2,000 grafts, 3,000 grafts? Well, are those grafts made of one hairs, two hairs? There are a lot of variables, and so things that can contribute to a better outcome would include the caliber of hair, the thickness of the hair shaft, the contrast ratio. So let's say that the hair shaft is white against white skin. That would look visibly denser than, say, black hair on white skin, or vice versa, white hair on black skin. So color contrast ratio is favorable. Curl, if the hair is very, very curly, then it is much harder to see the scalp, because really the definition of baldness is not just the absence of hair, but the visibility of how a bald scalp looks through thinning hair. So all of those factors can be a contributory element toward getting a better denser result. So let's say I transplant 1,000 grafts in someone with dark jet black hair straight on very, very pale white skin. That's very, very thin caliber. That is probably the worst result in terms, let's compare, not worst result. I mean, in terms of comparing the differences between the between one person getting 1,000 grafts, another person getting 1,000 grafts. There's so many variable factors. But the caliber is so important because we use that pi r squared, r is the radius. Pi, as you know, is 3.1415. It's just a numeric number, fixed to a constant. But if you look at the radius squared, if I double the radius, the surface area is quadrupled. So if you quadruple the surface area, it's 4 times denser. So let's compare two hair shafts. One hair shaft has a particular radius. Let's say it's a certain distance of, let's say it's arbitrary 2. Another person has a measurement of 4, micro whatever, millimeters or whatnot. If you look at the area, surface area that hair is covering, let's say it's that 2, it's 2 squared is 4. So it's 4 units of density. Now let's take that person that has double the radius. That's, as I said, it's an arbitrary 4. Well, 4 squared is 16. 16 versus 4, that is 4 times the density. So you can see that just doubling the radius can give you a density 4 times greater. So caliber of the hair is something that people don't always talk about. They always talk about number of grafts, etc. But for me, when I look at a donor density, I'm looking at the caliber of the hair. It's one of the most important areas, and the way that I communicate is this formula pi r squared. Hopefully that makes sense. On the flip side of that, another time I talk about pi r squared is the crown. So the crown is, if you listen to some of the lectures I've given on the crown, is an area that's particularly difficult to achieve full visual density because on the vertical scalp, it's sometimes a big area that gets bigger, and as that hair starts to miniaturize, it gets wider and wider. So it's a big area to cover, so you have to do a lot of cheating methods to get better visual density. And that's discussed in a lot of my other videos, and I'm sure I'm going to do a blog just on crown because I'm very passionate about crown baldness. But for the sake of this blog that's specifically, or podcast, specifically talking about pi r squared, how it's relevant, the pi r squared, the radius. Now, let's say I double the radius of the crown. As remember, that radius squared is the surface area. Now that surface area becomes 4 times greater. I have to use 4 times the number of grafts if I just simply double the radius. And people don't think about that. So dealing with the crown, you have to be creative in how you execute on the crown, from angles, density gradients, and all those things, not only to achieve a natural result, but also to reduce the odds of having a visual but also to create a beautiful, dense result as far as you can per graft placed. So this is why I always tell my patients that when I look at a crown, when that crown gets relatively larger, it is either something that I cannot achieve or accomplish, or I've got to cheat more, or give them a realistic expectation in terms of the full density, especially after a single session. So those are the two ways that I use pi r squared, a simple geometric formula that we learn in high school, and apply it every day in terms of communicating with patients about achievable results with hair transplantation. So hopefully that gives you some ideas about that. Come to see me in Dallas, Texas, or Plano, Texas, just north of Dallas, Texas. I've been in practice about 20 years, doing hair restoration, doing everything from FUE, FUT, female design, eyebrows, ethnic, corrective, everything. So hopefully that helps you out.